Thanks for joining us. I'm Anna Manuel. A recent study is shedding light on Medicaid expansion in our state. And as the race for governor heats up, this is becoming a big topic of debate. Fox 23 senior reporter Quentis Jones speaks to a doctor about how Medicaid expansion would impact the Magnolia state. Good evening, Quentis.
That's right. As you know, Medicaid expansion has been a hot-button issue in our state, and now a study reveals not expanding it could be costing lives. Tonight, a sobering statistic when it comes to Medicaid expansion. A study revealing that not expanding it is, quote, killing Mississippians.
There's a lot of reasons to extend health care to Mississippians through Medicaid expansion.
A study by the national nonprofit Center for Budget and Policy Priorities claims nearly 600 Mississippians have died prematurely over the lack of Medicaid. Here's pediatrician Dr. John Godet.
The study is looking at excess deaths. There are more people dying than what would be expected to be dying due to lack of access to health care.
Mississippi is one of about 10 states not to expand it. It's a topic also taking shape in the governor's race. Democratic candidate Brandon Presley favors it, but Governor Tate Reeves still says no.
Position has not changed. I am opposed to expanding Medicaid in Mississippi.
Some state lawmakers oppose this issue because they say it would cost too much.
Mississippi's own state economists looked at this issue and found that Medicaid expansion would pay for itself for the first several years.
Medicaid expansion would mainly affect people who fall in what's called the coverage gap. That means you make too much to receive Medicaid, but you can't afford private insurance. But no matter which side of the debate you fall on, Dr. Godet says we have to find ways to give more Mississippians access to health care. And research also shows expanding Medicaid reduced the infant and maternal mortality rate. Quentis Jones, Fox 23 News, Hattiesburg.